Welcome to the Wellness Law Podcast, where wellness and the law meet for contemplation and collaboration. This podcast is brought to you by the Center for Health and Wellness Law. I am your host, Barbara Zabawa. Dr. Efrat Lamondre, or Dr. E, as most people call you. Everyone, I would like you to meet Dr. E as our next guest on the Wellness Law Podcast. She is a public speaker and best-selling author with, this is so amazing, over 5 million followers on various platforms. And she's a nurse practitioner with a PhD, and she is a medical director, or medical disruptor, not medical director, disrupting and reshaping healthcare. She advocates against medical gaslighting, and that's what we're going to really focus in on today. But she also empowers patients to recognize that their symptoms are not just in their head. She's founded several businesses in the healthcare space, including EG Healthcare, a primary care practice, and EG Prep Education, a nonprofit educational institution. She's passionate about promoting longevity. She inspires individuals to realize they can achieve peak performance at any age, and she's a fervent advocate for nurse practitioners amplifying their voice in healthcare arenas. So welcome, Dr. E.
Thank you. I have to shorten that bio.
Oh, well, it's amazing. I mean, you're quite accomplished, and I'm just so thrilled that you're here with us on the Wellness Law Podcast. As I was mentioning before I hit record, I've written a number of articles about medical gaslighting in the context of bias in the wellness industry and trying to explain why there's so many people who go from healthcare, conventional medicine, to wellness practitioners. And one of the reasons that some studies have shown is medical gaslighting. So when I saw that you have done work and written about that very topic, I was excited to bring you on the podcast. So let's start there. What is medical gaslighting according to you, and how does it show up in everyday healthcare?
So let me define medical gaslighting actually as the patient experiences, because what I want to add is a twist to that. But the patient will experience it as a dismissing of concerns, a downplaying of concerns, anything other than, I believe you, let's talk about it. So there's this feeling where you're coming in with a concern, and then your experience is that it was dismissed or downplayed, and then you walk out without answers. So that is what the general consensus of medical gaslighting feels like. Yeah.
And I think there's a lot of people who've experienced that. I can think of a couple of instances in my own life where I've experienced that.
Yeah. And you're right. When I say the term medical gaslighting, for people, when it lands, even if they've never heard of the term, as soon as I say it, it seems to shift something inside of them. And they're like, yeah, I know what that feels like. That happened to me. It happened to my mom, happened to my grandmom. But I want to take a moment and kind of get clearer on that. Because if we really just hold on to medical gaslighting as I defined it, it's a very disempowering place to be. Mm-hmm. And it puts all the power on the provider and just says, well, they're downplayed and dismissed. And what I want to say, I want to differentiate. There are definitely some people in the medical world who are just not good. Okay, so let's put those ones on the side for a moment, because they're the outliers and they should be dealt with. But generally speaking, and we're talking about providers do not go to school and then start practicing just to dismiss patients, right? These are kind people. These are people who, went into medicine to help people. So how is it that we have so many people experiencing medical gaslighting and so many well-meaning providers? So there must be some sort of disconnect here. And that's what I want to talk about.
Can I guess?
Yeah, tell me. Guess.
Health insurance and administration?
Well, that's part of it, right? Health insurance administration is almost like a mirrored reflection of the actual problem. So the actual problem is that medicine, with all its protocols and its evidence-based, guidelines, is amazing, but it's very limited. And so insurances are mirroring that because they copy those protocols, right? Like where insurance will only cover the things that have been, accepted as evidence-based medicine. So the problem is a step before the insurance. And it's not necessarily a problem. What I think what we need to understand is our doctors, our NPs, our PAs have gone to school and have learned a set of tools that are amazing and wonderful, but can only solve a certain set of problems. And many of us are going into the healthcare experience with a set of problems that their tools cannot solve. And so this disconnect is what ends up resulting in medical gaslighting. And so what I want to surface here is that if we as patients can understand this and go in with the right expectations and go elsewhere for our other problems, we will never experience medical gaslighting.
Mm.
So, right. So if I may, let me just give an
Yeah,
example.
please.
So if I have, let's go out of medicine for a minute. I have a toilet bowl and it's running and I see the leak and I say, you know what, let me call this guy that I've always used. I've used him all the time. He hung up these shelves. He's great with what he did the floors. I'm going to give him a call. He comes in on a Sunday. He's great. You love this guy. You've known him for years. He takes out his toolbox. He tries with his hammer and his nails because he's a carpenter after all. And he looks at his toilet and he comes to you and he says, there's nothing wrong with your toilet. Right? He doesn't say I can't fix it. He says there's nothing wrong with the toilet. You wouldn't experience this as as gaslighting. You would say, this guy doesn't know how to fix toilets. And you wouldn't even get mad at him because you'd be like, ah, my bad.
Yeah.
I'm still gonna need him for the floors and for the shelves, but my bad, I called the wrong guy. You'll pay him for coming on a Sunday, talk to him about other stuff. Maybe there's something in the garage you wanna do. And then you're gonna call a plumber. And that is how we have to start treating our medical providers. Medical providers are there to find disease, to fix it, not cure, manage the disease, medicate the disease, remove the disease if it's a surgical. And that's it. If you're coming to them and saying, I don't really have a disease, I just don't feel well, I'm feeling something, and their tools can't find it, and we keep coming back and saying, well, why can't you find it? Why can't you find it? Why can't you find it? It is just like asking the carpenter again and again and again to come fix the toilet. Does that resonate?
That's a really great analogy. I mean, this is quite extraordinary and revealing for me because, I've written about the paternalistic kind of approach to healthcare that, is kind of historical in a way, where patients have come in to be, at the mercy and rely on the professional judgment of the care providers. And we have laws that, of course, support that kind of relationship: informed consent, fiduciary duties, standards of care that need to be met with licensure laws and all that stuff. But yeah, I love this whole concept of really trying to educate the patient to understand what the limits are of medicine. That's something that I actually had not heard before.
Yeah, so this is, I'm glad you can see that. This is a unique perspective I try to bring to it because I'm in both worlds. I have a primary care practice. I also have an integrated practice. And so I see the value in both tools. And now let me just say this, without question, there is a paternalistic issue. Women are not part of studies. Like without question, there is misogyny and marginalized community is not seen. So I don't want to take away from that there is problems in the system. And that studies are flawed because they really are geared towards the average white male. So there's no question that all of that exists. But all of that still exists in a particular system that we as patients should learn to access as we need.
Hmm.
And then learn to walk away from when we don't need it. And I want to empower our marginalized friends, not just women, to understand that they have this skill already and they use it every day. You don't have one person on your team that does everything at work. You don't have one person that helps you with your kids, right? There's a first grade teacher and there's a kindergarten teacher and then there's the babysitter and then there may be somebody who does soccer. You have this skill set of working with different people. You also have a skill set of knowing, I don't really like this restaurant anymore. Like you have these skills that you use every day, but something happens to this well-informed patient and they walk into the exam room and all those skills disappear. And they're suddenly like, okay, well, they can't find it. So either I'm going to question myself, maybe I'm crazy, right? They don't question. They're like, well, maybe you're not the right person. They either question themselves, get mad at the person, or go to someone else identical in the same system. And so they'll go, I went to 3 doctors. I mean, right, you've gotten 3 carpenters to come look at your toilet. So this shift, so like, yes, there's a problem in the system, but if we're just going to stay stuck and be like, this system needs to change, which would be lovely, we should be like, this system is working as it is designed. I will use it when I need it, and I will opt out and use my really good reasoning skills and go elsewhere for the other things that I need.
I would like to pick up on that. And first, I need to back up and point out a comment you made earlier, which was medicine, conventional healthcare really is to manage diseases, but not to fix. I picked up on that, and I wanted to. I was hoping you could maybe elaborate a little bit
Sure.
on that because that's very interesting to me.
Sure. So let's take something that most people are familiar with, because this is the truth for all diseases. Most of us are kind of sort of familiar with diabetes, right? There's a test, it's called an A1C. We know at a certain number, we have diabetes. And then under that number, we might have pre-diabetes or we might have normal. So we have the spectrum of normal, pre-diabetic, diabetic. So if you're normal, conventional medicine has nothing for you. If you're pre-diabetic, conventional medicine has nothing for you. Once I'm diabetic, conventional medicine is like, here's all your meds, here we go, here's everything you need. So we have tools to manage it once you're sick. But in the pre-stage or in the well stage to prevent it, there's no tools there. This is true for every disease. Once you are already in the sick state, you're going to want conventional medicine. You need the chemo, you need the surgery, you need the removal. But how to prevent, how to necessarily cure, it's not the job of conventional medicine. So even with something that you might say like cancer, well, what do you mean? Either you've cured the cancer. You have, in that sense, you've removed it, you removed the tumor, you've done the chemo, they're in remission. But are there tools to really talk about prevention? Are we talking about, well, how did we get here? What are you exposed to? What is your nutrition? How do we get through it? So it's like, no, we'll monitor. We'll monitor for the next 5 years. We'll do it every 3 months, and then we'll do it every 6 months. What are we looking for? Disease again, right? So, and if you don't have disease again after X amount of time, great, we don't need to see you anymore. But we're not, even in the world of oncology, we're not doing anything about prevention or actually making sure it doesn't happen. We monitor, we survey. And once it's there, we can act. Amazing, great, I love these tools. I don't want to go to a world where we don't have these tools. But you could see how it's only part of the problem, right? And so in the world of prevention, curative, if you have a thyroid issue, I'll give you Synthroid. It's great, it's necessary. Did I cure anything? No, I managed it. I'm not saying that everything is necessarily curable, but I just want to be clear that that is not what we do. We manage disease.
That's very interesting. And I want to point out that medicine, the medical care, is defined in a number of different places in the law, but the primary ones on the federal level, anyway, are the Internal Revenue Code, and then also by the FDA and the Food and Drug Act for drugs, what constitutes a drug. And I'll just focus on the Internal Revenue Code, Section 213D, to be particular. In that definition of medical care, which is what so many different programs rely on, is the word prevention, cure, and and so if you do any of those things, you prevent, you cure, and it says disease, illness, injury, then you are then you are engaging in medical care, and therefore then a whole line of other laws can take effect. You can get reimbursed through your tax favored accounts. You can get insurance coverage. That's what a lot of states base their licensure laws on, as far as what do we define medical care as. And of course, every state's practice of medicine, Medical Practices Act, has prevention and cure as part of the definition of what it means to be a physician or other type of provider. And
Well, I
put very
refer
many people in wellness into trouble because they
well,
want to help prevent, they want to help cure, but if they do, arguably from a legal standpoint, they're practicing without a license to practice medicine, nursing, whatever it might be.
I guess it depends on what you are going to define as cured, right? Because let's just go back to the cancer one because it's so visual. If I remove the tumor, it's cured.
Mhm.
If you start the concept of disease at time of tumor,
Yes.
but we start the concept of disease before the tumor shows up in the wellness world. We're like, but you've been feeling not well, you're inflamed, you're around mold, you're around Lyme, all these things that come out from it, right? And so, like, in this space of I don't feel good-itis, you're actually already sick, which may end up turning on the gene of cancer, right? And so what is the definition of cure? So if the definition of cure is just getting you back to a non-sick disease, are you cured or are you just not sick?
Yeah, I mean, that's a valid question, but unfortunately, I don't think the law makes that distinction. And I don't
The law doesn't make that distinction.
medical boards make that distinction either. I mean, well, we have to pick on medicine, I'm sorry, but they sort of have the whole pie of what constitutes, conventional healthcare. They can, in their scope of practice, do pretty much everything. So, if you start to wade into those waters of preventing or curing disease or illness as part of your wellness practice, you're arguably engaging in criminal act. I mean, that's what we as lawyers have looked at. That's what the courts have looked at when they've had cases kind of looking at this.
Well, I have a question for you then. If that's a very interesting perspective that you're saying, if you are, it- what you're saying in this definition is it's not just the intervention, right? It's not like just prescribing medication that makes you practice medicine. It's the fact that you're saying, hey, if you go on a keto diet, you're probably going to prevent your seizures. By the way, you probably will. You're saying that that statement by itself is already practicing medicine, even though you haven't done any medical intervention. You just, right. So it's very interesting.
Exercising professional judgment. And so the scholarly articles, I just finished one on the First Amendment free speech protection for unlicensed wellness coaches. And that kind of statement, that kind of assessment could be interpreted as by a court as exercising professional judgment. And then the question becomes, well, if you're exercising that professional judgment in the context of preventing or curing a disease or illness, then is that fall within the state's definition of the practice of medicine, and therefore you need a license, and you don't have a license, and therefore you are in violation of the law. So, and the Constitution's not going to protect you because we're talking about healthcare here. So, I mean, it's a very messy area, and that's why my job and my scholarly interests really dive into this whole dynamic and what can be said safely from a legal standpoint and done safely from a legal standpoint. So I'm finding your perspective also fascinating. And one of the things it's asking me to do, follow up on, is really looking closely at that word prevention as it's used in defining medical care and maybe arguing for its removal.
Well, let me ask you another question, if I may. Without question, stress is known to cause many diseases, right? We have the studies on it. So does that mean that therapists and counselors who are helping you manage your stress are also practicing medicine and are also should be thrown in jail? Because if if removing of stress can help cure and reverse disease, and this happens often,
I would.
then they're also, it's not just our wellness coaches, it's our therapists
Oh,
who are in
well,
trouble.
but see, therapists have their own licensure and their own scope.
Not to practice medicine.
No, but there's all so like how I tell my students when I'm describing the scope of practice of the various health professions, think of it as a pie. Medicine has hold the whole pie. So they can do everything, within their competence, of course. And then everyone else, nurses, therapists, pharmacists, whoever has a slice of that pie. So they can do a portion of that. And so for mental health therapy, for sure they can prevent, diagnose, cure anything that's related to mental health issues and not be in violation of the Medical Practices Act because they have, by law, their own carve out.
Yes, but you've delineated it as mental health. I'm saying that we now know that mental health and physical health are one.
Mm-hmm.
And so you're carving out, yes, they're working on depression, anxiety, but in fact, they can reverse autoimmunity.
Yeah.
And so where that gets obfuscated as well.
Yeah. No, well, for sure. I mean,
Fascinating.
yeah.
Good luck to you. You have a much harder job than me. I
Well,
just have to empower people when they go into the exam room. You have to get them out of jail.
well, I'm trying to just prevent them from going. That's my job, is to just
Yeah.
preventive from the legal side. And how can you safely do what you want to do as a wellness practitioner in whatever realm you want to do it, whether it's coaching or energy healing or, functional medicine or integrative health, however you define your wellness practice. What are the boundaries? Because it's not really clear.
You know, I would say if there was a way to do it, I would say since we have to look at disease on a spectrum from wellness to illness, and I would say conventional medicine starts at illness and on. It does nothing up until that point, but for somehow the definition that exists suggests as if it's doing anything here, and it has no tools for here. I would love if they had tools for here.
Yeah.
I would love it if we didn't need functional medicine providing for patients to pay out of pocket. I would love it if doctors, NPs, and PAs got an understanding of how nutrition works and how we can actually prevent and cure diseases by doing that. I would love that, but they don't. And so it's interesting that they have this extended scope into an area that they don't actually learn.
Right.
I would argue on the offense that how dare you try to operate here when you've never been taught this? You've only been taught illness on and management. Don't talk about prevention and don't talk about curative either, because you actually have never been taught to do any of those. You've been taught to bring people back to a baseline at best of lack of disease.
Yes. Yes. So, interesting twist that I'm thinking of, I often, as a lawyer, counseling different wellness practitioners, tell them, refer out when you see someone who's coming to you to cure a disease or illness. That's not your role. You refer them over to medicine, or, their primary care doc, whatever. But maybe we should be telling the PCPs, hey,
100%.
if your patient is coming to you complaining and you can't identify any illness, refer them to a wellness practitioner who can work with them to try to figure out the root cause, to try to stop it in its tracks before they come back to you with a disease.
Exactly what I tell my clinicians when I speak on this topic. So I speak to a room full of PCPs and I say to them, I poke some holes in some of their long-standing theories. And I say, I'm not asking you to start doing this. I'm not asking you to start figuring out how to mold test or talk about all these other things. I'm asking you to be aware that this world exists and add these people to your referral list. Yeah, so add and say, listen, and say to the patient, listen, I've done everything in my toolbox. I have not found any disease, but I really and truly believe what you're feeling, right? This is how we remove medical gaslighting with clinician. And not that they suddenly treat it, but they say, I believe you, but I don't have anything. I can safely say with all my tools that you're not sick. I've done the MRIs, I've done the CAT scans, you're not sick. But I could see that you're not well. I have not been trained on wellness. Here are a list of providers locally that I have, refer to, and I think they're wonderful clinicians. Go there, and I'll happily collaborate with them if we determine that we need a blood test or whatever. That is how we get rid of medical gaslighting. That's how we incorporate these specialists. I mean, that would be, outside of the ultimate solution, which is to have this as part of, medical training and insurance coverage. This is the next best solution for the medical. Instead of fighting these wellness coaches, accept the fact that you, my dear colleagues, are not trained in this, and add them to your referral list. It will make you a better provider.
What's then the response? When you talk to providers, are they receptive to the idea?
I speak mostly to nurse practitioners, and nurse practitioners are generally much more collaborative in nature.
Yeah.
So
They're required to in most states.
No, in less than 50% of the states at this point are they legally
Oh,
required
is
to
it
after a certain
then
amount of hours.
that improved?
Yeah,
Oh, okay.
yeah. So after a certain amount of hours, collaboration is no longer
Oh,
needed.
yeah.
We have some levels of autonomy in more than 50% of the states at this point. But collaborative in nature, I would dare say more because we're mostly female and just women are just more collaborative by default.
Hmm?
Maybe we're the better species, maybe not. That's up to you to decide.
But in that talk to a room full of MDs or DOs, and if
I
so,
haven't.
okay.
I haven't, but I imagine that if they came to my session, among other sessions, they would already be open-minded enough to have, right? Because usually there's several sessions going on.
Mhm.
So if someone's landing on the functional medicine approach to thyroid, they're already kind of dabbling. But if I had to go and just speak to someone who's really staunchly against it, they wouldn't be interested. And that, it's interesting that we don't go on the offense. Because imagine if a health coach said, I'm not really interested in medication and chemo or anything like that. You would like to end up in jail. But it's okay for an entire community to be like, we're not interested in wellness. That's nonsense. That's snake oil.
Mhm.
Based on what do you say that? Right? So we don't question that indoctrination, which is really, really problematic.
Mhm.
Because they're just waiting. They're basically, I mean, what do you write in your chart? Advise patient to return as symptoms worsen. It's a wait and see approach. And then we wait and we wait and we wait until something shows up. That's the practice of medicine.
Yeah.
You know, that's
Yes.
that's insane. Imagine if the plumber said, I see the carbon, and then eventually when the floorboards are warped, they're like, oh, I could fix your floorboards now. Great. Did you fix the toilet? No, amazing. But yet we allow this to happen here. We don't, like, even as you're speaking this, I'm recognizing that we're always questioning the health coaches, but we're not questioning the MDs.
Right.
There's no offense there. And we've bought into that even here. How dare you say curative? How dare you say preventive? Nothing that you learn in school is curative or preventative.
Yeah. Well, I mean, part of the reason why there may be some hesitation in being more offensive on the offense instead of the defense is there isn't as much in, political capital that the
Of
wellness
course.
industry has over healthcare. Healthcare just has way more resources, and if they don't, they could squash the message if it got too loud, and they have the evidence base. They like to
You
do
know,
that.
they could and they couldn't, and I'll tell you why. If someone had almost every single, for chronic care management, almost every single guideline starts with the first sentence, advise lifestyle modification. And then they go into a very robust medication protocol. But that sentence that they've embedded in their own guidelines, lifestyle modification, they actually are not trained on that first line, and it's in their own guidelines.
Mm.
So you could actually use their guidelines against really which modifications help that.
Mhm.
When did you advise them to add resveratrol into their diet in order to modify their high blood pressure? You have no idea what I'm even talking about, right? So actually in their guidelines is their own Achilles heel, and they just skip over it. Yeah. Low sodium diet. Okay, that's it. And then they go on. Okay, here's your lisinopril. Here's your amlodipine. So it's in there, but they're not educated on it.
Mm. So you think we
Sorry.
got
I know we went on
no,
that.
there's some leverage there is what you're saying, when trying to
Yeah.
Yeah, there's a lot. This has been a very rich discussion, and I know I'm walking away with a lot of to-dos, to things to think about and write about and explore a little bit deeper. So I really appreciate your insight, Dr. E. This has been incredibly engaging and just enlightening for me, and I hope the listeners will feel that way as well. Now, if anyone wants to learn more about you and your work, how can they do that?
Just come hang out on my podcast. It's called The Medical Disruptor. The criteria to be on my podcast is that you have to be some sort of clinically trained MD, PA, NP medical researcher, and then something happened in your life where you came over to the dark side or the bright side. And so you have this really strong clinical reasoning basis, and then you decide to go for more. And that's what we're all about.
So the Medical Disruptor podcast.
Yes.
All right. I'll make sure that that's in the notes for this podcast. And I assume people can find you on social media as well, your platforms.
Yes. Just my name, Dr. Efrat Lamondre. You'll find me.
Okay, I'll make sure that's in.
Barbara, if I ever get in trouble, I'm going to call you.
That's why I'm here. That's why I'm here. Well, thank you so much, and I really appreciate this, and I just wish you the best in
Thank you.
continued work.
Likewise. Thank you for your time.
Thank you for listening to the Wellness Law Podcast. You can find more wellness law resources by visiting the Center for Health and Wellness Law website at www.wellnesslaw.com, where you can also subscribe to our newsletter and follow us on social media. Until the next episode, stay well, stay hopeful, and stay legal.